Today, I wanted to speak to you about what labs that you should be getting on an annual basis. And the reason I thought about actually doing this live real quick, one, I just got off a podcast interview. So, I got to make use of this. Usually I'm in a t shirt, shorts, working away, or, less refined. How about that? So, but I got a question on one of the posts a few days ago, the one about triglycerides and blood sugars and insulin resistance. And they asked about what labs do you recommend? And outside the context of, trying to hone in on an illness, it's a good idea, in my opinion, to consider getting general labs once a year. And the reason I say that is because it's one thing to do all the healthy things. You're exercising, you're managing your stress, you're sleeping, you're eating well, but still things can go awry. So I like to kind of jump on things early if we start seeing a trend. And so it's not to be scary or, you know, add more expense. This is just another data set that we can use over time to determine what's changing. And as we get older, if we go through different changes in our life, like perimenopause and menopause, things can shift really radically. And a good example of that is I've always checked my lipid panel. I was active duty Air Force, so we had labs even when I was younger. And in medical school, you're checking things too, just out of curiosity. Over time, my LDL has never been over 100, rarely over 80. When I went through perimenopause and menopause, that transition happened very quickly. My LDL jumped into the lower 100s for the first time in my life. And I had been doing all those things. I was a healthy weight. I was running, exercising, doing all those things. But that was a real shift for me just to see how one hormonal fluctuation, a very important one, could really affect your metabolic health and you do everything else the same, right? And so that's why I mention this because things can happen. Maybe you're under a much heavier stress load or something else going on. Again, I just wanted to just give you some ideas of those labs and why. So let me pull up my list here. Okay, so first of all, it's important to understand that again, my these are just my recommendations. Obviously, speak to your doctor regarding what is best for you. I'm just giving you some general ideas and some reasons why I do recommend that my patients do certain labs. And again, it might vary depending on your age. So I'm going to hone in on my typical audience is middle age, like 35 and older, maybe 45 and older. These are even more important because things really begin to shift as we get into that more middle age and older bracket. So the first thing is a CBC. And what that is, that's a complete blood count, right? So basically this measures your hematologic health. And what we're looking here is white blood cells, red blood cells, and your platelets. Now, sometimes you can get a CBC with a differential, which then takes your white blood cells and puts them into the different categories of white blood cells. I think that can be important, especially if you have noticed that your white blood cell count is high or lower than it should be. And again, these are just references. When you do your blood work and they come back, you're going to get some general reference ranges. That's about 95% of the general population. Some people may be higher, some might be lower, depending on the situation. But anyway, what this detects is anemia, right? So maybe there's nutritional issues going on, chronic disease, maybe there's blood loss. It'll also reflect infection or inflammation with white blood cells. And the interesting thing with the inflammation is you may not even feel so much inflammation, but just if you carry excess body weight, typically if you see a BMI over 30, it's not uncommon that I will see white blood cells actually high consistently. Maybe we're talking about in the 13, 16 range when you're looking at the US metrics. And when we think about that, what is going on here is that that load, the extra fat that's being stored and the fat cells are no longer able to take in the excess calories and store that as energy for later use, it sends it off to be stored as visceral fat, and that will ramp up inflammation. The white blood cell is releasing different molecules that attract inflammation. So the white blood cells will actually be what we call an acute phase reactant, meaning that it'll increase with inflammation, but also infection and things like that. So just some things to keep in mind there. So if you're seeing your white blood cell trend higher than it typically should be, that could be an issue. The other thing is someone who is doing very well and having very low inflammation, you may actually see that white blood cell count actually outside of normal in the lower range. That is actually not uncommon, especially the patients that I see. I have a lot of worried well patients. And so they will come in and I will may see it 3.8 or 3.5. everything is checking out. They're doing very well, well fed, well nourished, exercising, just aging very well. They just have very low inflammation. It's really fascinating to see the spectrum of that. Now, again, these are just some general things. Now, the other piece on the CBC that is important to pay attention to is the size of your red blood cells. So, if you have large red blood cells, so that's a macrocytic issue. So now you could be anemic or not, but that might indicate that you need a little bit more B12, B6, B9, just a few different things that you may want to pay attention to. Now, let's say that you are anemic, right? The hemoglobin hematocrit is low. That size of this cell will tell me a little bit about, well, what is actually causing that anemia. So let's say that you have a low hemoglobin and hematocrit and the cells are very big. It could be a fact that you're missing B12. If the cells are normal size, this is what we call anemia of chronic disease. And what's happening here is that the red blood cells that are made in your bone, that inflammation is decreasing the actual production of your red blood cells. Now let's see that you have small red blood cells, which are also indicators on the CBC. That means that you're losing iron somewhere. Maybe you're having heavy periods, or maybe there's something else going on. In the sense of you had an acute blood loss, maybe you actually donated blood, or something else. You may have need to get a colonoscopy. Make sure you're not losing blood somewhere else. Again, just some general indicators, some thoughts around what a CBC does in for you. So, the next one is a comprehensive metabolic panel. Now, there's different types of metabolic panels. This one will include your liver function, and basically, it really talks a lot about metabolic homeostasis in your organ function. So we look at kidneys, we look at electrolytes, we look at your blood sugar, and like I mentioned, your liver. So the important thing about this is when it just gives you so much information, it's one test, and I could spend all day just looking at that. But the ones that I like to pay attention to are your liver. Let's make sure that is someone at risk for fatty liver? Is someone's kidney function kind of creeping up? Because typically chronic kidney disease is not something that you feel, right? But it is something we need to pay attention to, especially if you have high blood pressure or you have diabetes or prediabetes. We need to be paying attention to your kidney health. Now, the liver health is also another important thing to look into, because many times lifestyle interventions can reverse, especially early stages of fatty liver. And so, especially if it's non-alcoholic fatty liver. So, when you really want to pay attention to there. So, and of course, your fasting glucose. I'm always talking about blood sugar. Such an important thing to look at the trends. Most of my patients, I'd rather have those fasting blood sugars under 90 in the morning. So when you do get these blood tests done, I would recommend, fasting at least 8 hours, drinking only water, because that'll tell you a lot of information about your state, your baseline state. And so when you look at glucose, the reason I say, keeping that under 90 is that over time, what you will see is early insulin resistance starts showing up with blood sugars trending up. And when you had those fasting blood sugars trending up, so let's say this year it was 85, in 2 years it's 94, and then it's 99. Now it's hitting 103 and 105. You are definitely walking the path of insulin resistance, and we need to figure out what we can do to stop it and reverse it, which absolutely can be done, but just some things to keep in mind. Then we look at your hemoglobin A1C. So this basically tells me your average blood sugar or glucose concentration over the last 8 to 12 weeks. Now, the important thing to understand is that A1C is the stickiness of red blood cells, okay? So when you think about your A1C, and one of the things that we did today, I'm thinking about this, is I had a patient that I was working with, and we were interviewed together on a podcast because she's taken some amazing strides in her lifestyle to actually improve her pre-diabetes. And when you measure blood sugar, or your A1C, excuse me, let's say we did that in early August and we measured again just 2 months later. Remember, red blood cells live 90 to about 120 days. So we've definitely seen some shift in her A1C. It did drop. She lost 10 pounds. Blood pressure is improving. But what was interesting, though, was her A1C just dropped 0.1. But remember, there's some of those sticky red blood cells. Even though her blood sugars have dropped, her fasting blood sugars have dropped almost 20 points in the morning, are now under 100. Those sticky red blood cells are hanging around just maybe another month or two. So in another month or two, when we recheck that A1C, that's going to be a true reflection of all the hard work that she's been doing in the last 5 or 6 weeks. So there's that. The A1C that I like to see is 5.4 and below. When we start hitting above 5.4, and we hit that 5.5 to 5.6, this is that gray zone, right? It's kind of like that trending upward of glucose. You're still in the normal range by guidelines, but you're going to start seeing some signs of that insulin resistance. Now, when you hit 5.7 to 6.4, this is considered prediabetes. As far as I'm concerned, you might as well just consider yourself diabetic because the train has left the station and you're down, walking down the track. So what we want to do is really think about this as an urgent call. This is the canary in the coal mine, so to speak. But the canary is dying. And so we need to really start thinking about how can we improve our metabolic health. And my Substack's all about that. And I'm collaborating with people. You can learn how to eat that way, in a way that will really help. I'm teaching you how to exercise and how to sleep and deal with stress. So all those factors, you'll start seeing improvement in your insulin resistance. Okay, next is a fasting insulin. Now, this is one that's less common. But basically, it just tells me, what is your beta cells, which are the little cells that live in your pancreas, actually doing? What's their insulin production in a fasted state? And basically, an elevated fasting insulin will really precede higher blood sugars, right? And so because what's happening here is your insulin production will increase as the need to keep the glucose inside a healthy range. So when you start seeing someone's blood sugar already trending up, you already can guarantee you that the fasting insulin is higher than we want it as well. But before then, before the glucose goes up, the fasting insulin will go higher because the pancreas is able to produce more insulin to keep the blood sugar lower. I hope that makes sense. Okay, so now we got fasting insulin and we have a fasting glucose from the CMP that we ordered. Now we can actually put that into a calculation called HOMA-IR. And all it is, it's really simple. You can just type that in, HOMA-IR, and it will tell you an estimate of your insulin resistance, which is very, very helpful. I think I've written a couple of Substacks including that on there. But anyway, where I like to see your fasting insulin is around a 5.5 or below. Next is thyroid stimulating hormone, or a TSH. Basically, it's just a primary screen for one of the most common autoimmune diseases, especially as we get older. And it just to make sure that your thyroid's in check. Very simple to do. I've been hypothyroid for almost 30 years, since the birth of my second kiddo 29 years ago. And so again, I was only 25, 26 years old when that happened. And so something to consider. And it kind of sneaks up on you. You might see trends of your cholesterol going up also as your thyroid is not working well. You can also see fatigue, hair loss, constipation, weight gain, those type of things. Now, if it's normal, something else is going on. Some people chase, like, oh, I have thyroid disease when their thyroid's perfectly normal, working fine. I would say let's think outside the box and what else might be going on. Vitamin D, I think, is pretty self-explanatory. There's been so much information around vitamin D. It helps with calcium metabolism. It helps with immune regulation, insulin sensitivity. I've seen patients who've had no other markers abnormal in their early 30s. This was when I was active duty in the Air Force. Her vitamin D was 8, but she was dramatically fatigued. When we replaced her vitamin D, felt amazing. So after we got it to the level where we wanted, above 30, we stopped it and it dropped again. And so we had to keep her on a regular maintenance dose. And so again, just for her to feel well, that is something there to consider. Another one is by B12, especially if you eat a primarily plant-forward, plant-based type of diet. B12 is made by bacteria, right? It's not made by plants, it's not made by animals. And it lives in the dirt and water. So if you are eating a primarily plant-based diet, I would recommend that B12 should be a non-negotiable supplement. But the important thing is that B12 is also lowered in common medications. Like when you have someone who's buying over-the-counter, like proton pump inhibitors, or they're getting metformin for prediabetes or diabetes, that actually decreases the absorption of B12 from your food sources. And one thing to understand with B12, it can interfere, of course, like we talked a little bit earlier about your blood cells being made in the right size. It can also have a huge effect on your nerve health. And so sometimes when you have chronically low B12, you actually might have permanent damage. So it's certainly worth something to consider if you're feeling fatigued, hair, and just like tingling nerve pain, or if you're on those medications, it's certainly worth something to talk to your doctor about. Another one that I think kind of flies under the radar for a lot of people, especially if you're not anemic and you have normal iron stored test, is ferritin. And so ferritin is like the storage unit in the back, right? So I tell people, the complete blood cell count or that CBC tells your hemoglobin hematocrit. That is your blood that's available that's being used right now. The ferritin is your storage protein for iron. And signs and symptoms of a low iron when you're still maybe not even anemic is fatigue and hair loss and restless leg syndrome. So if you have dramatic fatigue and you just can't figure out what's going on, and you're having hair loss, you're like, what is going on? Or I have restless leg syndrome, difficulty sleeping at night. Certainly worth checking your ferritin. And if you want to get that ferritin closer to 50, maybe even 75, and that's where I would say. And so, just some ideas for you there to think about. Next is your HSCRP. This is a high sensitivity C reactive protein. And basically, it quantifies systemic throughout your whole body, low grade inflammation, right? And so it's produced by the liver in response to other inflammatory markers in the body, like IL-6 and what we call cytokines. Anything greater than 1 tells us that there's an increased risk for things what we call atherosclerosis, right, or plaque in your arteries. And so it's very sensitive also to other minute things like your diet, exercise, your sleep. I have also had a really interesting patient who had a root canal many years earlier, began to not feel well, had elevated blood pressure the first time in their life, dramatic fatigue, ended up going to the dentist just for a routine checkup. And they found that the root canal was infected. They fixed the root canal. Oh, and his HSCRP was elevated. That was the thing. And anyway, they fixed the root canal, all blood pressure, fatigue, all of that resolved itself. So pay attention to your teeth. Very important. And finally, I would say the lipid panel, right? And your ApoB and LP little a. I've written entire articles on the ApoB and go deep into depth about lipid panels and different things. So I just will kind of quantify it very quickly here for you. But basically, we want to see the quantitative and qualitative aspects of your cholesterol. So the ApoB reflects the total number of particles that can cause atherosclerosis. Your LDL, your VLDL, your IDL, and LP little a. Now, remember the LP little a is genetically determined, so it will fluctuate a little bit with lifestyle interventions, maybe 10%. But it's an independent risk factor than your total cholesterol or your LDL-C cholesterol. And again, the ApoB is shown to be a superior predictor of heart disease than your what they call LDL-C cholesterol alone. And so measuring that just gives you context of what's going on overall. And because when it's higher, it tells me that even though, let's say, your LDL may be quote unquote normal on your standard lipid panel, if your ApoB is high, it tells me that your LDL is smaller, or that those lipoproteins that are carrying your cholesterol are smaller because they need more of them. And those small ones are the ones that can be a little bit more dangerous. And so without going deep into it, that's it. So basically, those are the labs. I'm going to go over them again with you, and I'm happy to write an article or answer questions if you guys have them. So CBC, complete blood count, a CMP, which is a comprehensive metabolic panel, a hemoglobin A1C, just talks about your long-term glycemic or blood sugar control, your fasting insulin, right, which will be higher before your fasting blood sugar even is, the TSH for your thyroid, vitamin D and B12, ferritin for your iron storage, HSCRP for your high sensitivity your C-reactive protein for inflammation, and then of course your cholesterol panel, lipid panel with ApoB and LP little a. And you only need to really check the LP little a once. If it's elevated, you're genetically gifted. If it's low, you're good. And so again, just some things there to think about. So hope you guys found this. Okay, I can definitely bring that into an article. Marie says, I'd love to have this as an article at the list. Absolutely. And I've been thinking about it because I've been getting a lot of questions. All right, let me see if there's any questions that I missed. Feel free to put any questions you guys might have before I jump off here. Let me just make sure I haven't missed anything. Okay, I don't think I have any other questions before I jump off. And this video will be a post. It just has to do its processing, and you'll see that on the stack. Hey, you're welcome, Mafsi. Good to see you here. So, okay, everyone. Thanks, everyone, for joining me. I hope you found that helpful, and I'll be back the next time that I'm more refined for some type of interview or something. So, all right, guys, have a rest of your day, and we'll see you next time.